Folks, thanks for coming on the line with us today. My name's John Dubas. I'm a Vice President of Agent Success for Premier Marketing, and we'll be spending the next 45 minutes or so discussing the value of a marketing campaign that we feel should be part of every agent's marketing efforts to one degree or another. And that is the discussion on the value of direct mail. We have special guests with us today from Target with us today to help explain that purpose of it and the systems that they have in place to help us with this effort. And you'll see that as we go through today's presentation, how that can be of great value to you. A little bit of background and book housekeeping up front. Today's presentation is being recorded. It, along with some additional information, will be sent as follow-up to all those who have indicated interest in today's program. And we'll do a little bit of background to start with about our organization, Premier Marketing. We are a independent insurance marketing organization and insurance wholesaler that was founded in 1968. We're part of the Integrity Marketing Program, and we offer contracts to independent agents at the highest possible commission rates with recruiting contracts available when applicable. As I mentioned, we were founded in 1968, so this last year we celebrated our 50th anniversary. It's an accomplishment we're very proud of. It's an example of the whole small town boy done good. A small family agency in rural Nebraska has grown into one of the largest organizations of its type in the country. We're the largest producer for a number of Medicare Advantage carriers, including United Healthcare, Aetna, Meridian, and Anthem. And it is an example of what you can do by utilizing different systems and having a goal and working toward it. This is an example of the partners that we have across the country, a map of our legacy platform partners. So we have offices all across the country. I already mentioned our rankings with the different organizations that are a part of our platform. We do offer a full insurance portfolio that includes Medicare programs of Medicare Advantage, Medicare Supplement, and standalone drug plan type. A full portfolio of life insurance and annuities, including final expense and pre-need programs, along with short and long-term care and disability income plans, and ancillary benefits such as dental, vision, hearing programs, critical illness cancer plans, and hospital indemnity programs. That Medicare Advantage portfolio includes all of the large carriers that you know of and many of the smaller regional carriers as well. The same thing applies to the standalone prescription drug programs and a large and robust portfolio of Medicare supplement plans. Here's a listing of some of the ancillary benefits that we offer in the different categories with the carriers that are the leaders in their segment of the industry. When we speak of marketing programs, what we urge anyone who becomes involved in our industry to do is to incorporate multiple programs into a marketing plan that's set up and personalized specifically for you. And what we do in that circumstance is remind people then that we shouldn't put all our eggs in one basket and that social media isn't the answer to everything. What we have is a campaign that looks at different ways of reaching out to the public in a number of different areas through cold calls when they're appropriate, different community-based programs were available, working in conjunction with our carrier partners, not only for the lead support and programs that they offer, but also to help with community activities. There are certain programs where door knocking is still a viable option, not in the Medicare world so much with Medicare Advantage and prescription drug plans, a good way to lose your contract. But it is an option for folks who like to sell life insurance and final expense, and social media does have its place as well. What we ask is people look at their target market and coordinate a campaign that works together with direct mail, possibly the key to the entire piece of the puzzle. When we look at direct mail, some folks will push back and say, oh, you don't get any response. it's costly, I've got to work at it. Well, to paraphrase Mark Twain, the reports of the death of direct mail has been greatly exaggerated because it's still a viable means of working the population that you're targeting and making it a viable part of your program. What we have done today is invited our partners at Target Leads to come on and visit with us. We have Jessica Roberts and her compadre out of California, Mandy, to come on and visit with us about the systems that they have in place through their organization in partnership with Premier. So at this particular point in time, Jessica, this is the time where I told you I was going to shut up and actually let you speak.
All right, sounds good. All right, so to get started with the direct mail, that's our main market. We do consumer lists as well, but direct mail is our big part of our business. Consistency with ordering leads is a big important thing to keep those leads consistently coming in each week. We suggest usually to drop 1,000 to 2,000 about every 3 to 4 weeks to keep that flow coming in. They will trickle in over a 4 to 6 week time period. They don't all come in at the same time. You'll get the majority of them within the first 2 weeks, but they still trickle in over that 4 to 6 week time period. So that's why we suggest dropping every 3 to 4 weeks. John, you can go to the next slide. These are just a few samples of the options that we provide. You'll see over to the left, that is like an 8.5 by 11 flyer that goes in a window envelope. That is an option. Down at the bottom, you'll see custom postcards. We can do them in many different sizes. You're welcome to send us any designed pieces you already have, and we can print and mail for you. Or we do have the option, we have a design team in our Utah office, and for a $50 fee, we can help you design a custom piece if that's the route you want to go. And then up in the top corner, those are we call them a bifold format. They do mail first class. This is a majority of our direct mail, or these lead cards right here. You have the option to customize. We have pre-existing templates set up, but you can customize or make changes, add your phone number on there if you want to. There's many different options in customizing, but those are our 3 basic mail card options. John, you can go to the next one. And this is a big thing. Don't try to overqualify when you are setting up a new piece if you do choose to design your own mailer. We have found the more information that you give them on that mail piece, the less likely they are to respond. You want that option. You want to give them just a general idea of what they're responding to, so that when they respond, that's giving you the option, getting your foot in the door for you to be able to sell them. As a salesperson, that's the big key, is you just want to get that lead to get your foot in the door and then speak to the person. That's the hardest part, is getting them on the phone or getting in front of them. So if you give them too much information on there, they're just going to be less likely to respond, and that's going to hurt you in the long run. Next slide. Where to spend your money. The big thing is Medicare. That's where you're going to get your biggest pull, is Medicare leads. The dual eligibles and turning 65 are 2 of our biggest markets. We do have final expense. We have long-term care, fixed annuities, and then combo leads that talk about all of those. But Medicare is the best way to go to get your foot in the door. We do have many agents that do Medicare leads, and they add additional checkoff boxes. Also interested in long-term care, also interested in final expense. That's going to be better than doing a strict final expense lead to get your foot in the door. But Medicare and dual eligibles, those top 2, that's your best bet to get the best return for your money. Next slide. And over 65 Med Supps, this is a market that a lot of people don't market to heavily except for at AEP time. So the best options for those. You want to fine tune, like it says there, where you get the best rates at, where your carriers it's most competitive for you, kind of gear in on those areas so you're going to get a better return on those. Those mailers do average usually 2 to 2.5%, depending on what mailer piece that you're using. But turning 65, those guys get hit very heavily. It is a very popular market, so we typically suggest on those mailing out usually 4 to 6 months before their birth date. If you get any closer than that, you're going to have a hard time because they've just been inundated with mail at that point. So over 65 is a good market to hit because it's not mailed as heavily. Next slide. Higher incomes. We have found that when you market to higher incomes, those guys just don't respond. So if you're wanting to put a cap on the income and do Medicare supplement and do 30,000 and above, for example, we'll typically suggest to do 30 to 100 or 30 to 150 because you're going to get a much better return in that group than you are going all the way up to the 500,000 plus income. Those guys just don't respond. And as you see here, the low income people, those guys always respond. That's our highest return is between that 0 to 20, 0 to 40. Those guys respond much better. And so for the dual eligibles, of course, and the dual SNP, those do wonderful. We have great responses on those. Next slide. And this is a sample of our dual eligible special needs. That's our biggest return. It's over 3%. Typically, some pull a little bit lower depending on what state you're in, but typically 3 to 4%, and some states even higher. We have about 3 or 4 different samples to choose from. The wording varies, but that's one of our most popular ones. And as you see, that's how our bifold format lays out. It folds in half and mails out. It mails first class. And typically responses start coming in about 7 to 10 business days on those. Next slide. The order process. You can move on to the next one. This is the steps that we take when you contact us to place an order. We'll send you our lead catalog that has all of our samples in it. You can choose the mailer. That's usually the first place we start with because when we know what kind of mailer you're looking for, what you're marketing to, we can kind of guide you on those ages and incomes and specifics that work best. Then we would run a count. You can email us your zip codes or counties. We can do a radius around the area. We can also do the SCS sections of areas to run. Ages and incomes, you can be very specific on your age brackets. The income is estimated household income. You get those selects. We run the numbers, show you how many is available in each zip code or county, so you can see the breakdown of what's there. When agents do direct mail with us, we do protect the names for 90 days. So for a 90-day period, once an agent mails, we do not mail that household. So that's what the counts are going to show you is what's available at that time that has not been mailed to in the last 90 days. And then once you have your count, you lay out where you want to mail, what mailer you want to use. What we then do is send you a final order confirmation that has the full breakdown of what you're ordering, a copy of the mailer, and everything for you to review to make sure everything is correct. And then once you get that back to us with your payment information, we proceed and print and mail. It takes about 3 to 5 business days to get those printed and mailed out, and then typically 7 to 10 business days from the mail date, you start receiving responses. So that's usually about 2 to 3 week process from the time you place your order from the time you get responses. Next slide. And this is our CRM system. I'm going to turn this over to Mandy in our California office. She is very well versed on our CRM, and let her kind of give you a rundown on how that works. But this is how you would be receiving your lead responses when they come in.
All right. So as soon as the leads come in, our office in Texas will scan, upload, and data enter those leads into our TL Lead Manager system. So our system is a full contact management software program. So you can read all the highlights here, but basically you have access to your leads. You can set follow-ups and organize all of those, you know, the phone calls that you need to make, the appointments you've made, any follow-up mailings, all of that information is in this system. You also have the ability to see the scanned image of every mail response. So like I said, in our office, we will scan, upload, and data enter. So you have the scanned image and also the text version of all of the data. So you can also very easily search for everything that's in the system. So if somebody calls, you can find them by their phone number. So all of that information is in that system for you. You can also make call notes and any additional notes on there. You can find driving directions, see all of your campaign or order information. There's the ability to do commission tracking, letter writing, and there's always free tech support. So our California office is our main tech office, and we are always there to help you. So if you have questions, you're working through the system, anything like that, you can give us a call. There's a chat on the program, so you're not left worried or trying to figure it out. We're there to help. So we can go to the next slide. So this is our main screen. Obviously, it's blurred out, so you can't read any of the information on this person, but all of the information you need to have, for the most part, 90 to 95% of the information is on the first screen when you log in. That way, when you're on the phone with somebody and you're having your conversation, you're not clicking around, making noise in the background, trying to find what you talked to them about last time. It's all right there on the screen for you, so you can concentrate on your calls while still having that information. Go ahead and move to the next slide. And then here is an example of the scanned lead display. So when there's a tab that says lead card, and you can view the actual scanned response that that person mailed back. So that way you have their handwriting, anything that they wrote on the form will also be there, and you can see exactly what they responded to. You can also, within our system, you can click and see who you need to call for that day, what your last conversation was. You can change the disposition or the status of those leads. So if you have callbacks, you have appointments set, you have maybe appointments that you've made and you have a presentation that you have to do again, or it requires another one. All of that information is in the system, so you can easily and quickly find them, and you're not losing anybody. Nobody's falling through the cracks. In the system, you can also set up notifications. So if you aren't logging in every day, which we recommend doing, but if you're not, you can also get an email or a text when you have calls to make or you have appointments that you have for the day. So if you're going in and updating all of that information as you're actually working those leads, it will create those notifications for you. So you're not doing extra work for the contact management portion, you're just doing the work you should be, and it will make it easier for you to follow up on everybody. So here it says TL Lead Manager or TLOM. It's all about knowing who, what, when, and where. So that is the purpose of this, is to know all of that information quickly and easily and track all of it for you, making it easier to manage your business and not lose any opportunities. So next slide. There are also a lot of detailed reports. So if you happen to be distributing leads to agents as well, there are tons of reports that you can run to see how an agent is doing, how the campaign is doing, and how the leads are doing. So there's also reporting in the agent side to see how your campaign did. So you can break it down by zip codes, you can break it down by each order and see exactly how much was spent, how many leads you received, and if you're also tracking sold, you can see how many leads were sold off of an order. So that way you're keeping a really good tally of what actually happened with your campaign and better use your marketing money in the future as well. Next slide. So here is a bunch more reports. You can see all of those. These are all on the management side. So this is, like I said, where you can track each lead, know where it's going, find and monitor each prospect, know where any lead is in the sales cycle, track the efforts of the agents that you've been assigning leads to, and then, of course, with that, you can know when rewards, recognition, and repetitions are there. Then, yeah, next slide. And that's it.
Wonderful. Thank you, ladies. A couple of questions. One of them that's showing is, what if we get a bad lead, a kid responds, or no phone number?
Those we take case by case basis. If someone doesn't give us a phone number or they provide a bad phone number, we really have no control over that. But within TL Lead Manager, there is an option to select, it's a little button that says WP, and it will look that consumer up on white pages. And sometimes you can get an accurate phone number from white pages. But typically, if there's like bad responses, we take that on a case-by-case basis. It just depends on the situation.
And I can add to that too, the portion of it with if the lead is going out for a Medicare Advantage or a prescription drug plan, the carriers will prohibit you from looking up the phone number if it's left to you as well. So there's a compliance piece that comes in with that, that unfortunately, as Jessica said, it's out of the hands of all of us and in the hands of the consumer. And I stepped on someone there with a voice there.
That's all right. The other thing I wanted to note is you actually, so when the orders are sent, you're paying for the mailer and not for the lead. So no matter who responds, if they don't provide a phone number, we're still going to provide that lead since you paid for the mailer. And then you have their name, and you can always send a letter or anything like that as well, like an additional follow-up.
It's amazing the power of a handwritten note on a piece like that as well. It really does bump up your response. Another question is, what is the cost per thousand for the mailers? We will address that in part of our co-op program in just a bit, but I'll defer to the ladies on that as well.
Yeah, the base cost is $460 per thousand for the direct mail. Turning 65 is the only one that has additional cost, which is $15 per thousand in postage. And the reason that is because when the counts are so small per zip code going out, which is usually always the case with turning 65, the Postal Service raises the rates on us, and so that additional postage is for turning 65 only.
Thank you. An additional question is, do you have any free leads or promos for a new agent? We'll actually cover that piece a little bit later in the presentation. And with that, that's the questions we have at this particular point in time. As new questions come up, we'll address them at the end of the presentation too. I want to thank the ladies from Target Leads for coming on and displaying the system with us. We'll go through some additional slides here in just a moment and run through some things and give you a bit of a synopsis in a little later in the presentation as well. Some of the things, obviously, that you get in conjunction with the marketing programs that you select to participate in, be they direct mail or any of the other programs that we offer, is there are also other advantages to working with our organization. One of the first of which is, if I quit slipping the slides up and down, is the marketing support on direct mail campaigns. It is production-based, that based off of a monthly production, we'll either subsidize half the cost or a good portion of it based on the number of apps per month. It is a system that requires you to take advantage of it the month after production. We do send out reminders to the folks who qualify to make certain that they're able to take advantage of this subsidy as well. Some of the other things that we offer, as you are independent insurance agents and you have a portfolio of products to offer in different niches in our world, many times an agent will look for coverage with errors and admissions, and this is a program that's discounted very heavily that covers all of the carriers that you offer, regardless of who you contract through. There are some organizations that will offer you coverage on their blanket E&O, but it's only for the plans that you contract with through that organization. This discounted program covers you regardless of where the contract lies. We also give additional assistance on continuing education to keep your license in place, a means for electronic contracting. One of the things that we saw with target leads are letters in different categories that are available to you. That may behoove you to have multiple companies within a section of the world that we work with, and creating an agent profile through Surance Bay allows you to electronically contract, saves you a lot of time in the long run. It saves a lot of translation in our handwriting, and it's a great way for you to pull additional carriers to your portfolio that are of need to you. Additionally, we do offer a discounted disability income program with limited underwriting that's of help to a number of agents who look for that coverage as they're responsible as an independent agent for their own benefit package. We do also offer other training programs and resources that help you with a complete marketing campaign. One of the things we alluded to earlier today was the way that direct mail can support any number of marketing activities. This is additional information on other presentations like today that have been presented in the past and are recorded, like today's presentation, where you have access to them 24/7 across the board. We do also offer other electronic support. So as you get leads back from your direct mail campaign, there are ways to reach out to those individuals electronically, telephonically, through email, to pursue the business and perhaps even enroll without a face-to-face appointment taking place. Additionally, that enrollment system for certain Medicare Advantage, Medicare Supplement, and PDP programs through our Medicare Center program, which, by the way, there are webinars coming up on that, and one that's recorded on a list that will be part of the follow-up to today's presentation. It's a way for you to collect the necessary compliance pieces, the scope of appointment, and follow through with electronic enrollments and remotely as well. If you choose to work social media as part of your marketing program, we do have Coverage Made Easy, which is an exclusive program that can put those efforts on AutoPilot for you. There's some additional information that will come to you on that as well. Our organization does offer a number of different incentive programs as well. We make you aware of all the incentives that are part and parcel of your contract with different carriers, including different bonus programs and trips that they have available. But we also offer our own producer trip based on your production through carriers contracted with our organization. This year in April, the folks are going to Jamaica. Watch for the announcement very soon for 2020. As I mentioned, you want to look at an entire array of programs in order to market effectively. There are some additional things that we do offer. A contact list butted up against Do Not Call is available to you. And the message we do with that program is much like what Jessica mentioned with the mailing program, where in the Medicare world, the turning 65 population is referred to very often by organizations like ours or different carriers, where the baby boomers are aging and over 10,000 people a day are turning 65. Well, they're not all in your market, and there's a bunch of people chasing them. So we look to the 66 or 67-year-olds very frequently. They have less marketing pressure. They may have already received an increase in the premium of the program they initially selected, so they make great prospects for you as well. We also strongly recommend that if you cross-sell and offer life and annuity programs that you look at a 70-year-old, because those folks, if they are a Medicare supplement, true Medicare supplement prospect, they may be of higher income. They might have worked at an organization that had a formalized retirement plan, and we all know what happens at the age of 70 and a half with the required minimum distribution. So you're using a demand product to get in to offer other programs as well. We do have different marketing programs and training programs on working your community and your select market. The different retail programs that may be seasonal, ways to approach faith-based opportunities and provider marketing opportunities as well. These two circumstances fit very well with one of the ways that Jessica referenced with mailing a certain radius from a different location. If you work with a doctor or a dentist, having that ability to market a certain distance from their office can be very, very effective, and it can be a very strong point for that provider to work with you as opposed to a different agent. Some of the carriers do offer support for mail programs as well, and some of them do generate leads and pass them along. Generally, when we see that, I call that a Lazarus lead because you're looking to resurrect it. But you do have an option of accessing different leads through the internet. And once again, we reference our direct mail support. When you look at the direct mail programs, one of the things I want to reiterate to follow up on the points that Jessica and Mandy laid out for you, the system that Target Leads makes available to you does ask that you are consistent in your efforts. But if you think about that, it's like your exercise program. If you only do it every now and then, you're just going to feel the pain and you're not going to really see some of the results. Doing mail consistently keeps the flow of leads coming into you, and we all know how difficult it is sometimes to balance prospecting versus sales and customer support on the end of the process. And doing things consistently keeps that lead flow in front of you, so you always have someone to speak to. The portfolio of letters that are available to you are very important as well, because you might consider a possibility of mailing a program that has a higher response, even though that's not the lead product that you're looking to market. You're looking to get into as many homes as possible and make certain that that works. Jessica did mention that some of the best lead response that you get are off of some of the SNP programs. And it's important for us to remember that SNP programs, even though they have gone in 2019 from a monthly to quarterly special election period, that's a program we can market year-round successfully and get the support from the carriers that offer those type of programs that may even aid in our mail efforts as well. So some different things that come into play through the direct mail support programs and the systems that are offered by Target Leads. The CRM piece is invaluable. We get a lot of requests for CRMs, and the program that Target Leads has in place really maximizes your use of a program to make certain that you get the best value for the dollars that you're spending on your direct mail, making certain that you follow up with those individuals on a timely basis, and in certain circumstances, a repeated basis can make all the difference as to whether or not a program is financially sound or not. All that said, we want to make certain that you do realize that we want your business and we want to be part of the marketing programs that you have for yourself and your agency moving forward. And a lot of it boils down to the old saying of, when all is said and done, more is said than done. And it's a question of you creating a marketing program, seeing what efforts you want to put into it from different areas and putting it in place. We want to be part of that process. This is the contact information for our organization. Dialing this toll-free number, 1-800-365-8208, will get you in touch with any of the marketers with Premier Marketing. The people that are listed on this particular slide are here in our Texas office. But if you have a relationship with a Premier marketer, dialing that toll-free number will get you in touch with any of us. That said, We've gone through quite a bit of information today fairly quickly. So I'm going to check really quickly to make certain that we have all the questions through the system answered for you. And I see I missed one here. Why is there an echo? I'm sorry, I think that part of that was we were having some feedback in the system when we transferred from one presenter to another. I apologize for that. The additional information on some of the other programs that we referenced, including the Medicare Center program, that will come as part of the follow-up to today's presentation as well. Pardon me a moment. And you will get that on the link that comes to you for a past presentation, in addition to the opportunity to register for one of the upcoming webinars in that area. That said, I appreciate the investment of the time that you've placed with us today. It's your most valuable resource. We realize that, and we appreciate the opportunity to use part of that resource in presenting this program to you today. I want to thank you for coming on the line. Watch for the follow-up that will come to you through your email. Your marketers will be reaching out to you as well to make certain that we engage programs such as this to help keep you successful year-round, and that may involve some additional product, and we'll explain some of the reasoning and logic behind that as well. That said, thank you once again for coming on the line. We appreciate the time, and we wish you good selling. Thanks so much. Talk to you soon.